Today I want to discuss about the cardiovascular systems. So, before going into the deep diseases, I want to discuss the diseases of the blood vessels. Among these, the congenital anomalies you already know, and atherosclerosis, hypertension, inflammation of the vessels, aneurysm and dissections, and the tumors. So, before discuss about the details of the vascular disease, I want to give you some recapitulates the previous anatomy and physiology. All these blood vessels except capillaries have three basic coats concentrically arranged: tunica intima, tunica media, and tunica adventitious. And histology of the vessels in artery, these are the artery have these muscular elastic arteries, muscular arteries, arterioles, capillaries, venules, and veins. And sometimes I ask you in the last class what are the structure of a capillary, but mostly you fail to answer the questions. So, capillary is lined by a basement membranes, supported by a basement membranes, and lined by endothelial cells. And these endothelial cells are arranged having a intercellular cleft, and these endothelial cells having the pinocytic vesicles. So, we can say the pinocytic channels. So, the main cellular components of the vessel wall are endothelial cells, smooth muscles, and pericytes arranged along the capillaries and venules. Two principal mechanisms underlie the vascular disease. One is stenosis or complete occlusion of the vascular lumen. It may be either atherosclerosis, thrombus formations, or embolism. And another is the weakening of the vessel wall leading to the rupture or dilatations. Among these congenital anomalies, we want to discuss about the baryaneurysms occurs in the cerebral vessels, arteriovenous fistula, and fibromuscular dysplasia. And very important to know the atherosclerosis. Atherosclerosis occurs in the or affect the large and medium sized arteries, and atherosclerosis occurs in the small arteries and capillaries, that is arterioles, and in between the two is medial calcific sclerosis occurs in the calcification of the muscular arteries like the femoral, tibial, radial, or ulnar arteries. Atherosclerosis mainly important the coronary arteries and circle of Willis, and internal carotid arteries, popliteal arteries, and also the lower abdominal aorta. So, I want to discuss about details about the atherosclerosis. Atherosclerosis is a vascular disease characterized by intimal lesions called the atheromas, which protrudes into and obstruct the vascular lumens and weakening the underlying tunica media. And it is the basic lesions where the plaque having the central core of lipids, mostly cholesterol and cholesterol esters covered by fibrous cap. If you see the pictures, of a atheromatous plaque. Previously, I also tell you that the center of the atheromatous plaque is the lipids, that is cholesterol and cholesterol esters containing few lipid-laden macrophages, and smooth muscles migration to the, and also the fibrous cap. Among these, smooth muscles, macrophage form the foam cells, and lymphocytes also infiltrate into the atheromatous plaque. So, you have to know what are the common sites of atheromatous plaque formations. Our important topics is the coronary artery and the vessels of circle of Willis. Others are abdominal aorta, popliteal arteries, and internal carotid arteries. Mostly you have to ask, in atherosclerosis, what are the modifiable factors? Why? Because you can avoid it if you modify your lifestyles. As for example, modifiable factors are hyperlipidemia, you can control hypertension, you also can control cigarette smoking, and if you can give off the cigarette smoking, then it will be better. Diabetes you can control, and inflammation also. All these factors are modifiables. If you desire, you can modify your lifestyles. But non-modifiable factors are if you have the genetic abnormalities, family history, increasing age, and male genders are more prone to develop atherosclerosis than female, except females after menopause. So, pathogenesis of atherosclerosis, first injury to the endothelial layers is the initiating factors in the development of atherosclerosis. If you see the picture, first injury to the endothelial layers, what are the causes? The endothelial layer causes injury, the hyperlipidemia again, hypertension, smoking, and hemodynamic factors also important to cause the endothelial injury, toxins, virus, and immune reactions. Then chronic endothelial injury, what happened? Response to the injury, endothelial dysfunction, that is increased permeability to leukocyte adhesions, monocyte adhesions, and emigrations. Then macrophage activations and smooth muscle cell recruitment. You see that movement of the smooth muscles from the media to the plaque. And then smooth muscles proliferations, collagen and other extravascular matrix deposition, and extracellular lipids. And there is also infiltration of T lymphocytes and collagen leading to the atheromatous plaque. You see the picture, if there is a atheromatous plaques, what happened? In the arch of the aorta. Easily you can assume that before complete obstruction, this atheroma formation causes the ischemia of the heart, ischemic disease. So, atherosclerosis progression in the following sequence, again the endothelial injury, increased vascular permeability, leukocyte adhesions, and thrombosis. Again I am telling you, the accumulation of the lipoprotein, mainly the low density lipoprotein and its oxidized form in the vessel wall. Then monocyte adhesion to the endothelium, followed by migration into the intima and transformation into macrophage and foam cells. Platelet adhesions, factor release from the activated macrophages and platelets, vascular wall cells inducing smooth muscle cell recruitments either from the media or from the circulating precursors. Smooth muscle cell proliferations, extracellular matrix production and recruitment T cells, and liquid accumulation both extracellularly and within cells, that means the macrophage and smooth muscle cells. So, the components, three principal components, the cells, connective tissue and lipids. Clinical consequence of the atherosclerosis, most important is the myocardial infarctions. And then second one is the cerebral infarctions, others are the aortic aneurysms and vascular disease, peripheral vascular disease. But if you fails to diagnose the myocardial infarctions, then your life may be very miserable. So, if fails to diagnose, what happen? What may complication arises? Acute local ischemia, that means decreased oxygen supply to the dependent vessels. Rupture and embobilizations, aneurysm and thrombosis, focal ruptures and erosion leading to atheroemboli. It may cause hemorrhage, calcifications, or in chronic cases may lead to the chronic ischemia of the kidneys. So, our need how to prevent the atherosclerosis is very important to how to prevent the atherosclerosis, thereby the disease process. Get regular medical checkup, control your blood pressures, check your cholesterols, and do not smoke. Exercise regularly, maintain a healthy weight, eat a heart healthy diets, and last and important, manage stress. So, if you maintain these factors or is this advice, then you can prevent the atherosclerosis, thereby preventing the myocardial infarction, cerebral infarction, other complications. Thank you to you all.